The upper end is large. Okay. It has a tuberosity here that faces anteriorly. Okay. This is also known as the shin bone. You can see sharp anterior border. You can feel your own shin bone, and a portion is covered by muscles and portion is just bone exposed. Now, this is the anterior. Tubercle looks anteriorly, and the lower part is also having the now side determination. This is the medial malleolus. Now, the lateral group here articulates with the lower end of the fibula. That forms the lateral malleolus. Now, you hold it like this on the right side. You see, this is you see your own, feel it, okay, the medial malleolus. Don't hold it like this. This should be medial malleolus medially. This you hold it like this. Hold it like this. You just, the articular surface, it articulates with it forms the bones forming the foot. Now, this is smooth. Now, this is the main one identification point of which side it is. The medial malleolus is large. The lateral malleolus is contributed by, this is the lower end of the fibula, and this articulates here. It's not a pair. It's not a pair of this bone. Okay. Now this medial malleolus is large, and this is small lateral malleolus. Now, when we describe the fibula, it will be told to you. Now, mainly we will go through that. This is your medially. If I hold it like this, it will be lateral. Okay. Or you hold it like this, it can be medial also. But it's a concave posterior surface. But what you should see, the anterior and the tubercle. This is the main thing. When the bone is in the tree, you pick up, you just see the lower end. And you see the sharp shin border like this. You just hold it and you see the sharp shin border, the tubercle anteriorly. And this, you hold it in the right hand like this. একবারে এর বাইরে কোনো চিন্তাই করবে না. Group, upper end, and don't. You just hold it. No one will be asked that which side bone. The examiner won't ask you which side. Side determination, you have to see as you pick up the bone, so you just see like this. Be sure that it is, you are saying right, then what are the criteria? These 3 points are the criteria of identifying a tibia. This is now the upper end. Now it forms the knee joint. Okay. And over here, the femur with the acetibular cavity forms the hip joint. It is a unstable joint or stable joint? Stable. Very stable. Hey, stable. You have said it's stable. Right. ঠিক আছে, আবার এরকম করছে তুই খালি মেসির কিক বলবি না, রোনাল্ডোর কিকটা বলতে হবে, কারণ ও পেনাল্টিটাও দেয়। Now, I told you, see, this is the left side. Now, this is the complete articulated with the fibula. Okay. The anterior shin, this anterior border is sharp and it is also known as a shin bone. Okay. During football or any game, hockey or something like that, people like, who used to like, they play rough and tough. They will always try to kick on the shin bone. So you fall. And also during games, there are your football or any tennis or it might be cricket, anything. The knee joint is very vulnerable to this thing, any fracture or any problem. Okay, and the foot, even the lower end. Okay, now you just have to identify, and then this is an articulated foot. This is the articulated foot. Now you see the patellas here, and this is a tubercle, anterior tubercle. The ligamentum patellae is also inserted there. Now, if you see the posterior aspect, now over here, the cartilage and menisci are attached, and some ligaments. And now, I will just it's drawn. See, you see the soleus muscle. This is the popliteus. Okay, this is popliteus, and this is the solial line. Now, fascia covering the popliteus. Here. These are the tibialis posterior, the transverse fascia of the leg. Now, this is the popliteus, the other end of the popliteus is in the femur. It is also known as locking, unlocking muscles. That will be questioned also. What is locking and what is unlocking? Okay. Now, Now you see, you will be asked now the attachments on the condyles, and you will be asked also what are the functions of these and how they contribute in the knee joint. Okay. Now you see this is the medial meniscus, this is the cruciate ligament, this is the lateral meniscus anterior end, this is the lateral meniscus, this is the posterior end of the cruciate ligament, and this is the medial meniscus of posterior end. Now this is the cartilage, this is the thing when it is cut. Now anterior to posterior or posterior to anterior. As you think it will be easy for you to remember, you will be asked this one question. It can be also illustrate and label a diagram. These are all simple diagrams. You have to draw and label it. If you have a long question, like might be incorporated into your long question, 14 marks or 20 marks, whatever, 20 marks. Then when you give the exam of this first examination semester, you will be seeing that there are many questions, 4, 5, 2, 1, 3, like this. You're already studying that. The format you have to know. Then you think it will be long. Then you don't go on writing this. You draw, illustrate, and just label it. Label it. You will get the marks. But you just narrative, you don't have to. You have to be very judgmental, and don't go to the narrative. Too much of narrative. But you draw 3 figures and you label it. Now you have to know one question, that the knee joint. Knee joint in many components, it will be short questions or MCQ. You have to, accordingly, you have to draw it. তুমি খালি একটা knee joint, the knee joint, you just draw, illustrate, and see, put the meniscus and the cartilage, the collateral ligaments. Now this is the ankle joint. We are the knee joint. Describe the knee joint under the following heads: type, articular surfaces, ligaments, bursae, and relation, movements, and applied aspect. Knee joint is the largest and most complex joint of the body. It is formed by medial and lateral condyles of the femur, tibia, and patella. Lateral condyles of the femur, tibia, and patella. It is a major weight-bearing joint in the body, hence the most stressed joint in the body. It has articulations of medial tibiofemoral, lateral tibiofibular, and patellofemoral joint, hence is a complex joint. The knee joint is classified as follows: modified hinge joint, condylar joint, complex joint, and compound joint and patellofemoral joint. Now, why knee joint is very important? You just see this skeleton, you read from the skeleton, and you have to be knowing the knee joint is classified as a modified hinge variety of synovial joint, permits flexion and extension. Condylar joint, as it involves medial and lateral tibiofibular articular joints. You just see you correlate. After seeing the bone there, you please come and correlate. And condylar joint, as it involves medial and lateral tibial joints. Complex joint, as joint cavity is partially divided by menisci. And compound joint, as femur, tibia, and patella participate in its formation. Patellofemoral joint is a plain synovial joint. Now, knee joint classification and articular surfaces. The articular surfaces are condyles of the femur, the patellar surface, tibial surface, intercondylar surface. Now tibial condyles, lateral condyle and medial condyle, intercondylar area, patella, posterior articular surface. Types of classification: modified hinge, synovial, condylar, complex and compound. Now you see yeah, the patella is here, the upper end of the tibia, this is the lower end of the femur, and the fibula over here at superior tibiofemoral joint, inferior tibiofemoral joint. Okay. Now you can see the solial line over here. This is a popliteus muscle. In this groove it comes like this, get attached like this. This broad band. But the thing is in the femur, the tendon comes. Okay. Now now you just see, 5 of you come, you see the thing, just compare, see it today. Then it will be clear. Then you go and your home and just draw small, just not card, don't make cards, you'll be lost. You just draw it in your khata, just rough. Just label it. Don't go in narrative. You just first today you won't want to. What I would suggest, after seeing this, after seeing the bone, then you take your notebook and just draw diagrams and label it. And when you after 10, you go for the reading. And also you discuss amongst it, or you go tomorrow. Today you do this thing, see the bones in group. কারণ তোমার যখন ভুল হচ্ছে, when you are wrong, sometimes what happens, see people sitting, squatting or sitting, cutting sabji or household work, doing household work, these areas get bit swollen up. Or in a shop, they don't stand. Primitive grocery shop, they will see, you will get over here, there will be a big swelling. The synovial membrane sometimes get inflamed, and then it repeatedly sitting like this or sitting like this, that gets swollen up. And you don't mislead, you have to just see, feel it soft. Sometimes it gets inflamed and they come for treatment. Don't go for an incision. Try to avoid it. Then because you give some anti-analgesics and some antibiotics or something, then say chymotrypsin, trypsin, these drugs that reduces the inflammation. And the swelling, whatever you have to, that will be again when you go to the clinics, you will be seeing. But these are the most common areas in the lower limb to have of this thing. Or if you are sweeping, like you just kneeling down, and you have even in see, they have a mark, the Muslim for namaz. They have a dark scar over here. They just bend down and bow, and naturally they have this. These are the your now please, it's your bone set, Baba. তো কত লাখ টাকা? দেখো. See all the books, at least I have gone through. Saying just the illustration, the ছবিগুলো দেখা are more or less same. So don't hunt for, for 5 marks or 10 marks, you go and hunting or downloading or seeing the net. Don't. একদম খাতা মানে আমার হচ্ছে যে 60% ইউ হ্যাভ টু ফোকাস। চলো দেখ বইগুলো যা আছে না দারুণ। হ্যাঁ, তো জাস্ট সি। আমি কিছু নতুন বলছি না। হ্যাঁ, আর এবার এবার কি হচ্ছে ধর টিবিয়া প্যাটেলা, প্যাটেলা এক্সামিনার বললো তো তুই 90 পেয়ে গেছিস, এবার তো গোল্ড মেডেলটা দেবে, তো তখন প্যাটেলাটা তুললি, এ তুই বল ডিসক্রাইব ইট, বা তোকে এক্সামিনার বললো সেটা দে। হ্যাঁ, কিন্তু গোল্ড মেডেলের স্বপ্ন দেখতে হবে। দেখো 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 দেখো